We'll be beginning with today's W3 webinar series, which is sponsored by the PCOS Society and supported by Torrent Pharma. Today, we have a very interesting topic. Vitamin D, as we all know, is also known as the sunshine vitamin, and it is synthesized in our bodies and has numerous functions. So is vitamin D really a hormone or a vitamin? That will form the crux of our discussion today. I am Dr. Aditi Godbole and I am the coordinator for today's session. I welcome you all. So our moderator for today's session is the ever dynamic Dr. Pankaj Desai sir. He is the consultant OBGYN specialist at Janani Maternity Hospital, Baroda, and has been the former Dean Associate Professor and Unit Head at the Medical College at Baroda. Sir has several accolades to his name. He has several gold medals. He is an excellent orator, has numerous publications and research papers for which he has been awarded for the same. Many accolades, and the most notable amongst all is the Lifetime Achievement Award for contribution to the subject, and which was PCOS in the year 2022. We welcome you, sir. Our experts today, we have a very esteemed panel. So moving on to our panelists, Dr. Kanti Bansal Madam, she is the director at Safal Fertility Foundation, Ahmedabad, and was awarded with the prestigious Royal College of Obstetricians and Gynecologists Distinguished Service Medal for Development of Women Healthcare. Madam is the founder-in-chief at the International Journal of Human Reproduction and Development. She has several papers and publications to her name and has been chairman at several organizations and has also been felicitated by numerous Women Achievement Awards. Welcome, Madam. Moving on to our next, Dr. Padmavati Menon, Madam. She is a retired professor and head of Endocrinology Department at St. G.S. Medical College and KEM Hospital. She has been the past president of ESI and is a consultant endocrinologist at Jupiter Hospital, Thane. She has had several papers published and as well as textbook chapters in her name. Welcome, Madam. Moving on to the next panel. Dr. Ramesh Panchal, sir, is a professor at the Department of Orthopedics at PS Medical College and SK Hospital, Gujarat. Sir has been a recognized PG teacher and examiner for several years and is a member of the Indian Orthopedic Association. His special interests lie in complex trauma and joint replacement. Welcome, sir. And our final panelist for today is Dr. Bela Dr. Madam. She is a consultant neonatologist and pediatrician at Saifi Hospital, Bharti Hospital, and SRCC NH Children's Hospital. Welcome, Madam. I would now request Dr. Pankaj sir to kindly begin with today's webinar. And I move over the proceedings to sir.
That was a very professionally given introduction. Very few times I have seen this. They go on and on and on and on. Very sharp, and I am sure you must have done some homework on this. Well done. As usual, we will start with a prayer. I always start with a prayer. May I become at all times a ship for those with oceans to cross, a sanctuary for those in danger, a lamp for those without light, and a servant to all in need. Usually when a topic comes for a panel discussion, it's a very stock topic. But today, initially, I felt that this is a very easy topic, but that is not what Dr. Durusha and her team is. They appear easy topics, but no, when you go deep inside, you realize how complex it is. So I always congratulate Duru for having great depth and unconventional approach to discussions. I appreciate her for the scientific awareness that she has spread regarding PCOS, not only amongst the obstetricians and gynecologists, but even amongst the other medical practitioners. I commend her for encouraging many young people and not very confident people to come on the platform. And therefore, I have seen many of her programs rising because of unknown talents which she taps. Friends, you know that today's topic is a question. Vitamin D, whether it is a hormone or a vitamin. One question on the panel discussion will be over. All of us can go home Saturday evening. But no, that is not what Duru wants to do. I will come to this. We will build the ground for the answer to this question and then try to answer it. You will all agree with me that this is what vitamin D has done for many people. I'm not telling the doctors, but pharma companies, some laboratories, and so many. Okay. No, rainfall of notes and bundles and wards. Therefore, for them, Vitamin D is neither a hormone nor a vitamin. For them, vitamin D is God, nothing less than God. And when you have such a confusing state, when you have such dilemmas coming up in life, I have seen right from the time of when he had a dilemma, and when Chandragupta Maurya had a dilemma, till today, Pankaj Desai, and I represent all the students here. Whenever we are having a dilemma, we go to our teachers. And I am fortunate that we have wonderful teachers today to teach us. We have Dr. Kanti Bansal, who is, as you know, infertility expert, as one of the first test tube babies of Gujarat. Dr. Bela Doctor, who is herself a doctor. And therefore, we look forward to her inputs, a pediatrician so vital for us. Dr. Menon Madam is our Sachin Tendulkar, because she has to bat and she has to pull us through. Dr. Ramesh Panchal, a very worthy senior. When I was a student, Dr. Panchal was already teaching. So, a very respected academician. And when he left medical college, he with Dr. Vaishnavi, his colleague, there was one very common utterance in the whole academic world, irrespective of the faculty, a big loss to academics. And of course, Aditi Godbole. And we have already seen her prowess as to what she can do with any job on hand. Therefore, now my teachers are going to lift me. And when I say me, all the students who are listening to this panel and who may put in their feedbacks and questions, they are going to lift us from the classroom and take us to actually the battlefield. Yes, this is what our teachers are going to do. They are going to blow the conch. Keep your sound open, because I will be using it quite often. To bring it to start easily, life was very simple when we were undergraduates. As Aditi said, this is the vitamin, the sun vitamin, or vitamin from the sun god. But that's all. Nothing else. We didn't know about the magics and the wonders of vitamin D. Whether they are there, they are not there. We will be discussing it through. But this was what vitamin D was for us. But as Robert Boyle said, the sun is the most important thing in everybody's life. Whether it's a plant or an animal or a fish, and we take it for granted. And probably because we have taken for granted, there are lots of confusions. And synthetic vitamin D also stepped in. And so many types of vitamin D stepped in, creating a confusion. And for that, Dr. Padmavati Madam has to help us. Because even a small change, as you can see here, of at position 27 of a carbon atom, and you get a new vitamin D. So, Madam, you will have to help us. And please take us clinicians. We are hardcore clinicians, so basically academicians. Please take us through the maze of vitamin D1, D2, D3, and anything new which might have come. Padmavati Madam.
Thank you for inviting me, and thank you for, in Marathi we call it हरभऱ्याच्या झाडात चढवायचं.
Oh.
तसंच झालेलं आहे. But see, we are constantly learning, and what we want to know today is the D1 which is produced in the skin and converted into D3. D2 is a tocosterol which is available from somewhere else, from animal proteins. But as far as we are concerned today, we are talking mainly of D3. The D2 which is available in the market abroad is not the correct hormone, correct vitamin to be taken. They would love to have our vitamin D3 in their market. That's what they tell me. So the actions are mainly by D3. So D2. We will concentrate mainly on D3.
D3, okay. Thank you, ma'am. We now move to the battlefield. And that is where Google steps in. My son always asks me whenever he is an IT wizard and holds a very senior position at the age of 30 in an American company. He always tells me, Baba, why do you want to still teach when you have Google? And this happens to us, all of us, in our consulting rooms. This happened to me. Mrs. A, at 26 years, Google smart patient. walks into my clinic and pointedly asks me, I had suboptimal levels of vitamin D in my company-sponsored whole body scan. Can this be a risk marker of my reduced fertility? And if it is so, then we can start planning our pregnancy earlier, lest we want to wait because she's 26 and she feels that her career still needs to be consolidated. I request Dr. Kanti Bansal Madam to tell us as to what she feels about this aspect of vitamin D.
Thank you so much, Dr. Pankaj, and I really appreciate that sun that you showed. And I feel we cannot forget the sun rays and the good effects. And then I think that itself can give us the answer to this vitamin D is a hormone or a vitamin. Now coming to this Google Smart lady, I think she has a point, when she's concerned and she says that it has shown suboptimal results. We first of all need to confirm with her, ask her to bring and show us the reports and see whether really they are suboptimal. Is it less than 30 nanogram? That is the first thing. And the other one that you very nicely asked, can it be a risk marker? Definitely, it could be a risk marker for reduced fertility. And so in case she has reduced, that is less than 30 nanograms, I would advise her to take or be supplemented with 2,000 to 4,000 IU per day. And if the value is more than 30 nanogram, in her case, it is not good to give her any vitamin D, because if the vitamin D goes up to 60 nanogram, it could be toxic.
Thank you. Thank you. That was very brilliant. Ma'am, if I have to identify 3 books which changed my life, one of them was by Hans Rosling. The title of the book was Factfulness, F-A-C-T-F-U-L-L-N-E-S-S. Many of you might have read it also. Hans Rosling was a doctor, was an epidemiologist. And when he used to address at Davos, the World Economic Forum, and his co-speakers used to be people like Melinda Gates and Bill Gates. And who used to attend his sessions? People used to pay thousands of dollars to attend his sessions. And we had people like Narendra Modi, Donald Trump, Barack Obama, the rich, the powerful, and so many of them used to attend his sessions, so much so that people like you and me can never think of attending because it used to be a house full very fast. In one of his books, in that book, Factfulness, he tells that in case of doubt, fall back upon statistics, fall back upon data. Your answer is crystal clear, but still let us see what data tells us as regards this. And most of the times, data concurs. Let us see this. This data coming from in 2018 tells that observational studies show that vitamin D deficiency is surely a risk marker for reduced fertility. Although certain RCTs and meta-analysis reported some other beneficial effects, it is still not clear whether vitamin D supplementation improves fertility. So, your recommendation, we are taking less than 30. You can supplement, at least it will not harm. Thank you, madam. I am taking you now to another area. And that area is of the principal focus of this platform, the PCOS society. So we will attack now polycystic ovarian syndrome or disease, or we are not going into that controversy. But PCOS surely is being diagnosed or at times overdiagnosed these days. Lots of awareness is now seen, and that we will agree, and that is thanks to people like Dr. Duru, Dr. Kanti Bansal and all, who are continuously sensitizing us to this condition. I am myself a son of a ma who had PCOS. She passed away 30 years before, when no such fanciful things were available, no more depth available. So it is very much there. A subject with PCOS, whom I had advised lifestyle changes, because Dr. Bansal will agree with me that that is the most scientific thing to advise, asked me, sir, can I avoid this boring rigmarole of exercises and dieting and this and that and just take vitamin D? Dr. Bansal, what do you feel? How good is vitamin D in PCOS?
Excellent. Once more, you have given me a very good clinical situation, and I'm hand in hand with you, Dr. Pankaj, because I definitely feel that in the PCOS subjects, the first line of management is always lifestyle modifications or lifestyle interventions. Now, we all know that in cases of PCOS, majority of these PCOS patients do have insulin resistance, and also there's an altered lipid metabolism. I also know that vitamin D alters this. It really helps in insulin resistance and also to some extent in lipid metabolism. And, we should be supplementing with vitamin D, but however, I would not just supplement with vitamin D, but also go along with lifestyle management. However, said this, I have also come across in the literature wherein they completely avoid the workouts and diet, etc., our lifestyle management, and they are experimenting with just vitamin D. But at this level, I would like to continue both lifestyle interventions as well as addition of vitamin D.
Okay. As I had initially told that, Padmavati madam, if at any stage you feel that you have something to add, please do.
I have a comment to make here. Normally, obese people have vitamin D deficiency more than thin people for whatever reason. And today, none of us are going into the sunlight during the time that we need to be exposed. That is between 10:30 to 3 p.m. in the daytime. So that is something which we are not doing. There are several studies done for various things, including PCOS. And I think last time we had a session on PCOS and vitamin D. It really doesn't help. It has no. If you are vitamin D deficient, you need to be treated, whether it is PCOS or any other condition. But you are not vitamin D deficient, then I don't think it is going to help by treating vitamin D. And regarding insulin resistance, several studies abroad, even we did glucose tolerance before and after vitamin D and all. No, it really doesn't help. It started several years back when I was at NIN in 1976 or 77. From then onwards, several studies have come, but there is no proof that it will do anything to insulin resistance.
When two geniuses are juxtaposed, that is the time when we fall back upon data. Let us see what research tells us. This article, it has come a randomized control trial, that there are some papers about vitamin D RCTs in women with PCOS published that have, however, only inconsistently reported effects. So both of you are in a way right. It may or may not help. Padmavati madam, we are going with you also. That yes, be careful. You might be bordering irrationality at this stage. If it means for us as students, that don't jump onto the bandwagon of vitamin D as regards PCOS is concerned. Wait for a little while. Madam, Bansal madam, you have a great friend. And that great friend of infertility experts of PCOS is nowadays AMH. A few days before I was conducting a webinar, a lecture on PCOS in adolescents, and that is where AMH stepped in, and there was some discussion. So these two friends are anti-Mullerian hormone for people who might be from other faculties, and PCOS. My query is, while on PCOS the focus automatically these days shifts to AMH. Madam, Bansal madam, can you please guide us about the current understanding on the correlation between AMH and vitamin D?
Thank you for this, Dr. Pankaj. I would like to say that PCOS and AMH, you very correctly said, they're like embracing each other because we are so much worried. On one hand, we have increased AMH, lots of antral follicles, and we are so scared of that dreadful ovarian hyperstimulation syndrome. Now, on the other side, we also see in some of the patients the diminished ovarian reserve in these PCOS patients as well. Now, it's so nice to know that vitamin D has a beneficial effect both on the, on this increased AMH and also decreased AMH. In cases of increased AMH, the vitamin D, what it does is it decreases the AMH level, and also it increases, what we call as the anti-inflammatory soluble receptor. So what happens is, because of these effects of vitamin D, it is very beneficial, according to me, for the prevention of OHSS. On the other hand, for the diminished ovarian reserve, what it does, it increases the AMH level, and also it increases the AMH level and decreases the FSH level, so that it is beneficial to these patients. So how does this happen? Because the AMH levels go directly through the AMH promoter and indirectly by regulating the number of granulosa cells and AMH signaling of ovarian follicles. That's how these actions take place. I think if there's anything else you can put. Yeah.
Okay. Let us see what is the evidence. What is the evidence telling us? 2020 evidence, that is quite recent. It tells that, in conclusion, these are, most of them were from different databases. Cochrane database is the principal one. In conclusion, the results of this systematic review demonstrates that the relationship between vitamin D and AMH is surely complex. Large randomized trials of vitamin D supplementation focusing on different vitamin D status ranges are necessary to gain more insight into the nature of the relationship and the potential benefit of vitamin D to female reproduction in general. They are not ruling it out. So as of now, you need not change the policy. And as Dr. Kanti Bansal has said, it may help, it will help. We can take it in this way, it may help. Let us wait for some more data. Okay. We now come to another condition, and that this unpleasant condition is unpleasant for both the patient as well as the sufferer as well as her doctor. And this is endometriosis. Endometriosis is not comfortable for anybody. Either you are operating or treating or having, it is not something which makes you comfortable or which makes you okay. Say, those who treat malaria are not uncomfortable at malaria, though they are empathic towards the patients. But to handle endometriosis in surgery or in at any point, infertility treatment or anything, this is the face which comes in front of you, of both the patient as well as the doctor. And that is where our team in our hospital, where that is our hospital, me and my wife, but our team has many other people also. So our team discussed the other day that in all subjects of endometriosis, we should get vitamin D level done, irrespective of the type of treatment that is decided. Is there such a strong association between the two? Because I am usually referred to as the final word, but here I remained silent. I said I will wait for our panel discussion which is coming up, where brilliant teachers are coming. So the question is that, is there a very strong association between endometriosis and vitamin D? And does vitamin D supplementing potentiate favorable results in subjects of endometriosis? Dr. Bansal, please.
Yeah, Dr. Pankaj, I would advise your team to really start doing this test for vitamin D estimation. And I also feel that there's a strong relationship, in the sense hypovitaminosis D is a potential risk factor for endometriosis. Another very important aspect as far as endometriosis is concerned is that there's a negative relationship between vitamin D levels and the severity of endometriosis. So we definitely need to look at the vitamin D levels and also supplement these women. That is my message.
Ma'am, do we need to get the levels done, or straightway a suspected case of endometriosis?
I think you're a research person, so am I. there's no harm in getting the, it's such an easy test, right? And so we could just go ahead and get the test done.
Let's see what the data tells. 21 studies have been included. This is a Cochrane database. 21 studies were studied in this review. And amongst them, 12 examined the relationship of vitamin D metabolites, 8 with vitamin D binding proteins, 3 with VDR polymorphism, and 2 with vitamin D regulatory enzymes. And there are discrepancy between the outcomes of the available literature publications. Given the heterogeneity, so the authors, they tell us at the end that given the heterogeneity and diversity of the present studies, more research is required to elucidate the association between vitamin D and endometriosis. So, madam, I as your student, and I here would like to take it in this way, that as of now, just let it be, wait for some time before jumping to conclusions. And that is what I will tell our clinical meeting, that this is what is the data which is coming out. It may be helpful, but let us wait for some more time for the results to come. Dr. Bansal, is it okay with you?
Yeah, but however, if we get the testing done and if it is low, I think we should supplement.
Okay, fine. Got it. So get the testing done. Okay, let it be a part of the routine now for subjects of endometriosis. Thank you, madam. That was a brilliant insight. Miracle, jadoo, and that is IVF pregnancy. Okay, still they tout it as a jadoo, though at any instance of time in my practice, and I don't have a huge practice, I have at least 8 to 10 IVF pregnancies running. I don't do IVFs, please. I don't do IVFs, but I do obstetrics. I am a generalist. Few months before before Corona, I was on one of the regular visits as a visiting professor in Australia. And this time I had to give a lecture in Melbourne at their association. And they asked me, what is your specialty? I said, I am a generalist. I do typical general OB/GYN practice. In a typical day, I would even suture an episiotomy, conduct a delivery, do a TLH on endoscopy, do a color Doppler, and even do a dressing and do a consultation. So this is a generalist. I don't do IVFs as yet. But yes, I do endoscopy, yes. But then we get patients, or our patients who have been sent come back pregnant, and therefore no more, because then science steps in, miracles step out. And therefore, what the science has been very successful in IVF pregnancies. But then IVF and IVF pregnancies are a museum of a myriad of medications given. Right from the treatment, I recently got an IVF pregnancy with 14 medications to be taken, most of them daily. And she was early pregnancy. 14 medications, most of them daily. Obviously, there has to be a vitamin D. Okay. And it was started before pregnancy, when the pregnancy was being planned. And it means that IVF was being done till today. So maybe when she came to me around 7 weeks pregnant. Does vitamin D improve your IVF results, Kanti Bansal, madam?
Yeah, I think that doctor unfortunately has written 14 medicines. I don't think I have given 14 medicines to any of my patients in my 35 years or 40 years of my career. I'm sorry to comment this, but it's not good.
We are not specifically bringing any names. Never.
Yes,
I will never.
So, according to me, vitamin D truly plays a very key role in human reproduction. And once again, I feel we should estimate the vitamin D levels in all our patients who are undergoing this IVF treatment, so that we exactly know what are their levels. If the levels are less than 30, then the results are not so good. So we need to supplement. And if the vitamin D levels are more than 30 nanograms, then I have seen that there's a very good embryo qualities seen in these patients, good implantation rates, the endometrium is formed very nicely, and also there are good live birth rates. So this is a very inexpensive drug. That doesn't mean that we need to give to each and every person. Always be more specific, get the testing done, and definitely definitely it has a major role to play in many of the events that occur during IVF, and it gives rise to a positive result. Yeah.
Okay. Swami Vivekananda has said at one place that you question even your teachers. You know that there were 3 occasions in his life where he tested Thakur. Thakur means, Ramakrishna Paramhans. Okay. I consider myself unfortunate that I was born after Thakur went away. Okay. So, and Swamiji, a great ardent, you can say, for him, Thakur was his breath. And still he has questioned him. Today I am taking that guts to question the teacher for this panel discussion on basis of data. And the 2020 November data, madam, I am going to conflict with you. The data tells that serum vitamin D levels do not influence IVF outcomes. In terms of clinical pregnancy rate, in terms of live birth rate, or in terms of ongoing pregnancy rate. So it seems we may have to review our thinking regarding vitamin D. And this is data, madam. I cannot venture to challenge a teacher without yourself, working very hard for this. Whenever in any clinical meeting as a postgraduate student, when I was putting something in conflict with any of my teachers, I used to pass sleepless nights because they are your teachers. Today I am doing that. Pardon me, madam, this is what data tells, that Fertility Sterility, a very reputed journal for Bansal madam, and would like to share that I am one of its peer reviewers. Recently I have peer reviewed one of its articles. So this is what the article tells, that regarding vitamin D, please go slow as regards IVF rates. We are not going further in this. We are straightway going to the next situation. The same Google Smart patient I am bringing here. That Google Smart patient of infertility extended her knowledge show still further. She told me, after I had given the answer regarding her previous reduced as a marker, sir, while you are handling my vitamin D levels, can you also test my husband for the same? He may be having subfertility due to this. How justified is her fear? Kanti Bansal madam, please.
Yeah, there are many studies these days which shows that vitamin D does have good effects on the semen parameters, and they do have a positive effect on the human male fertility potential. And most probably, the studies also say that they bring about good, sperm motility. And it is also said that there is also vitamin D metabolism seen in the testicular tissue as well. So does
that automatically mean or translate to more success rates, more pregnancy rates?
No, that we cannot say.
But definitely, here it comes, madam. Observational studies report that vitamin deficiency is associated with low serum testosterone concentrate, as you mentioned. But RCTs have by the majority failed to show an effect of vitamin D supplementation on testosterone results. So, vitamin deficiency and low serum testosterone, yes, but that may not automatically translate to clinical effects if you start supplementing vitamin D.
Exactly.
So there is some gap in between, and for that we are going to go to Dr. Padmavati madam very soon on an allied aspect. But before that, somehow with or without vitamin D, pregnancy is achieved. Okay, our subject is pregnant. Now I am taking Dr. Bansal to an area which she may not be very comfortable with, and that is obstetrics, where me and Aditi are very comfortable with, and that is where 1 or 2 questions only on obstetrics, and then we will start disturbing Bela madam. Because once the baby comes, we require Bela madam. Vitamin D supplementation is now a routine in all pregnant subjects. And I have seen my wife also supplementing, and many of prescriptions which I receive because I get reference cases. We both practice together. How good is this relatively new habit, which all pregnancy challenges will and will not be held by this habit of supplementing vitamin D?
Thank you, Dr. Pankaj, but then I think you will have to give the correct answers. I'll try my level best.
Please.
The minimum normal level of vitamin D is 40 nanograms in pregnancy. And there are many, conditions which may get improved. I'm going to say may reduced or probably the risk of getting pre-eclamptic toxemia, that could be reduced. Maybe it could reduce the risk of gestational diabetes, and also reduce postpartum hemorrhage. But if the preterm deliveries before 37 weeks, it has no difference to make.
That was a wonderful.
And then
exactly corporates, what do you tell?
The baby's, the bones, teeth, kidneys, heart, and nervous system may get developed better with vitamin D.
Okay. 30 trials, 7,000 plus subjects across 3 comparisons. Reduces risk of preeclampsia, gestational diabetes, low birth weight, and coming to preterm soon, and may reduce the risk of severe postpartum hemorrhage. So may reduce the intensity of postpartum hemorrhage. But supplementing pregnant women with vitamin D and other nutrients may make little or no difference in the risk of preterm birth, that is less than 37 weeks. So these are the clear decided things. We will not shake the apple cart. Madam, one more thing which the pharma company is, and this is the last question for you. I will bring you again back at the end, okay, when we will mature to the main question. And that is the safety is foremost in the mind of all doctors, but we as obstetricians specifically, because we handle 2 patients. One of the 2 subjects, one is the mother who can speak, and the other is the unborn child who cannot speak. Therefore, we have to be considered both. And my question to you is that these days, for some time now, one of the advantages the pharma company touted about high-dose vitamin D was that its administration is needed less frequently. So patient compliance is better. However, conservative clinicians like me wonder if this was safe enough in pregnancy. Madam, what do you think, please?
Yeah, I think it is safe because vitamin D3 therapy given 50,000 to 100,000 IU per week. It rarely exceeds 100 nanogram per ml and never reach toxic levels. And there's no adverse effect at this level of supplementation. The serum levels do not exceed the 100 nanogram ml. So we don't have to be so much.
That was a brilliant answer as was expected from you.
And studies also showed that a monthly dose of 50,000 IU of vitamin D rapidly and safely normalizes these vitamin D levels in deficient subjects, and daily 2,000 IU dosing it's a similar effect and safe.
As both regimens treat vitamin D deficiency successfully, that is what the Cochrane clinical answers tell us. And consuming weekly high dose of vitamin D3 makes it more acceptable. For mothers with apparently no apparent side effects. Therefore, weekly high dose of vitamin D3 can be safely administered. This is what the data tells us. And this is one change which can be, if you are hesitant, you can adopt in your clinical practice as regards we as the students who are listening to you all is concerned. Somehow the pregnancy is achieved, the baby is in the world. And we invite now Dr. Bela Madam. Madam, your comments on these observations, I will tell you the reason later, because it is confusing many of us many times. Severe vitamin D deficiency may cause rickets in infants or children and osteomalacia in adults. However, subclinical vitamin D deficiency is more prevalent and is associated with osteoporosis and higher incidence of falls or fractures, which Dr. Ramesh Panchal also can take a cognizance of. It was reported that 96% children with rickets were breastfed. Since breast milk contains inadequate vitamin D. The American Academy of Pediatrics 2008 recommended infants who are exclusively or partially breastfed require 400 international IU of vitamin D daily from the first few days of life. Bila madam, please guide us.
So definitely, thank you for this, Dr. Pankaj Desai. Severe vitamin D deficiency will definitely cause rickets in children, and we have seen a lot of effects of this. Genuvalgum, genovarus, we see pigeon breast. We definitely used to see a lot more rickets when I was training than now that I see them nowadays, because I think more and more people are aware and they're giving more and more supplementation with vitamin D, and will cause osteomalacia in adults as well. So we do need to have cognizance of the fact that vitamin D is an essential vitamin for children, and especially in their growing years, because they have a higher need for vitamin D as well. Subclinical vitamin D seems to be like almost, I think you do anybody's vitamin D levels today, it is going to be subclinically, it'll be suboptimal.
Are you skeptic about this?
There is some skepticism, but I think I have to believe what I see. I have to believe what I see.
Because this discussion came in subclinical hypothyroidism as regards pregnancy is concerned.
Yes, so you wonder how everybody, there is a question of why is everybody deficient in vitamin D? It is definitely, a question. I'm not sure it is increasing the incidence of falls, fractures maybe, but I'm not sure about the falls. Breast milk contains very little vitamin D. I love breast milk, and I think all babies should be breastfed. What used to be good was that previously mothers used to be adequately, replenished in vitamin D. They used to work out in the sun. They would be farmers' wives working in the sunshine, which automatically gave them, even the pregnant woman would be out there working in the field. So she had adequate vitamin D. And the first 6 months a newborn has, if it has had a full-term pregnancy, will have again adequate levels of vitamin D in the first. There's enough stores for the first 6 months. And exclusive breastfeeding is meant to be for the first 6 months. And it's only after the 6 months that we advise that other, supplementary food should be added, which could supply the vitamin D. So nowadays, because moms tend to be a little bit deficient, we are all sedentary workers, we are all bound to the house, we don't go out in the sunshine enough. It is possible that they've not transmitted enough stores to the baby. So it's a good idea to give vitamin D to the babies, because it is a very essential vitamin in the growing years.
Okay.
So 400 international units has been, I think internationally, long-term, it has been quite established that that's a daily requirement that we require for our adequate bone growth.
When we were in pediatrics,
this is something we know since we are little children in the medical field. Yeah, so I think we don't argue with this fact. We are, and somehow, and because it is hard. You may say it's easy to do vitamin, but in children to do levels is not easy. To prick them, to collect blood is not easy. It is easier to supplement the 400 international units on a daily basis for infants and small children. So it is a rapid phase of growth. So it's very, very essential.
That's a teacher. You can see the teacher. Typically, this is how you have responded. Beloved, now holding on to you. As a UG student, the strongest association that we were taught was the association between vitamin E deficiency and rickets. Has anything new come in this?
In terms of rickets and vitamin D deficiency, I don't think anything new has come. The commonest cause is vitamin D deficiency. Of course, there are many inherited causes of vitamin D dependent rickets, hyperphosphatemic rickets. We won't go into that. That is a very, very complicated subject. Vitamin D has, as we have rightly said, it may be a hormone because it has so many feedback loops within the body that maybe it can be considered a hormone rather than just a vitamin, because it is first of all synthesized in the body, and it has relationships with parathormone, it has relationships in the kidney, how it works on the distal tubule, on the proximal tubule. So there are many, many things that the vitamin D does, So it is, but that has not changed since I was a UG student at least.
Okay, ma'am, one more point to this. Yes, we are discussing vitamin D. Now its relationship with calcium in combination as regards rickets is concerned.
Yes.
What is the current thinking? Alone, calcium alone, vitamin D alone, vitamin D in calcium, any combination or anything alone better?
So it depends on what is the population we're dealing with. If it is say a premature child, I would want to give calcium as well as vitamin D. If it is just a normal newborn, I would not supplement calcium as well, because you will get adequate calcium from milk and later on from other food sources. If you have adequate vitamin D levels, you're going to get adequate calcium if you're just supplementing a normal child. But if there is deficiency, if you're definitely seeing a deficiency, and this may have then caused the calcium in the body, the whole total body calcium to have depleted, then I would need to supplement calcium as well. If I see that on my X-ray, there is definite rickets, there is going to be osteomalacia, there is overall total body calcium, which I can't easily measure, but I know then that calcium is also diminished, then I would supplement calcium as well. And if I come in across, of course, one of the commonest things we used to see as residents was that 8-month-old nice chubby child who came in with a hypocalcemic fit or a hypocalcemic tetanic episode, which of course then requires calcium to be given. That child needs to be admitted, given IV calcium before we even start vitamin D, because then again the vitamin D is going to cause me to deposit the calcium into the bone, which will decrease my serum calcium. So again there will be an imbalance and I may have further trouble with maintaining my serum calcium levels. I have to give both at that time.
That low certainty evidence that vitamin D plus calcium or even calcium alone improves healing in children with nutritional rickets compared with vitamin D alone. So
I don't think calcium alone promotes healing in children with nutritional rickets. I think vitamin D is very, very essential in the healing of rickets. I don't think calcium alone will do it.
Okay.
Calcium plus vitamin D will do it.
Okay. Madam, when I was doing my undergraduate posting in pediatrics, and then after as an intern, these charts, I used to feel, something very miraculous. It would give me a straight idea as to what the thing is happening. You just plot it. Now, I have brought it here for a specific reason. Does vitamin D supplementation affect the linear growth of a child with or without other micronutrients? Does it affect vitamin D?
I think if there is rickets, if there is a deficiency of vitamin D, it can affect the linear growth.
Yes, no.
But not just supplementing. If I give somebody who's a normal child and I just keep giving him vitamin D, he's not going to become taller. He has his genetic potential. He has so many other factors that need. I can't just say, "Oh, ye bacha chota hai, isko vitamin D de do, ye acha, ye tall ho jayega." That doesn't work. I'm sorry. Only if there is vitamin D deficiency, if he has rickets, then the vitamin D is going to help. It's not going to help every single child.
This is a quite a recent study, 2021, towards the end of the year. Evidence suggests that exactly as you tell, oral vitamin supplementation may result in a little without. Those of you know English. If little is without an article, it means no. All little means really small. Little without an article is no. So if you go into English of this, there is little or no difference in linear growth, stunting, hypercalcemia or hypercalcemia compared to placebo or no intervention. So Bella Madam, we are with you. Thank you very much. I'm coming to the area.
Can I have a comment on this?
A little emotional. Yes, Madam. Sure, please.
I agree with you. It has no effect on normal child's growth and development. But when a child is brought for short stature, we also look at vitamin D rickets because there are other types of things.
Definitely, ma'am. Definitely. I am saying if there is other, we talked about rickets of other origin. We are not, this is not the topic of discussion. And
that's right. But short stature requires that evaluation.
No, of course. 100%.
Beautiful. Childhood bronchial asthma, I have a little emotional attachment. I need not go much into it. I will tell you the reason later, or may not tell you also. But when someone in my family had childhood bronchial asthma, I had scurried through all available literature, left, right, and center, decades ago. Of the few points I vividly remember, one was that as the child develops adulthood, it gets less or can even go away, which in this child has gone away. The next, I don't know, we are not going into that area. The next was vitamin D has a positive role to play in reducing the exacerbations. Bila Madam, please guide us regarding the current thinking on this as regards the childhood bronchial asthma and vitamin D.
So I think there's a lot of excitement about the role of vitamin D in many aspects of our body, right? It seems to be the magic, pill for everything. You have depression, you take vitamin D. You have this, you take vitamin D. You are having too many infections, you take vitamin D. So it seems to be like the current, magic wand that people are, prescribing. So there are some hypotheses of why it may help in especially, respiratory infectious diseases. I think that's going to be your next question as well. And so there are many postulated hypotheses, I would say, about how vitamin D, you were talking about VDRs and VDRPs, so there are now it has been, what has recently come out is that there are many tissues in our body which also have a sensitivity to the vitamin D. They have receptors on their cell wall which accept the vitamin D. The vitamin D, they have, the hydrolase, alpha hydrolase. So they can hydroxylate the vitamin D to an active form and have many effects on the, T cells and the macrophages and the activation. Possible effects. Yes. On the in vitro, they have found.
Does it reduce the exacerbations?
So that's what I'm trying to tell you, that a lot of the exacerbations are connected to viral infections and asthma. So many of our we see, especially in the little kids, many of the exacerbations are related to, you get a minor viral illness, a child who's not prone to have hyperreactive airway disease will manage without getting into asthma. But a child who is prone to have asthma will probably react to the viral infection and get a bronchospasm. So if vitamin D has an effect on viral infection, yes, vitamin D will decrease the exacerbations of asthma. That's what I'm trying to say.
Madam, I'm going to come to you on this a little later. But this is a trial, 435 children and 2 trials involving 658 adults. Whilst we are confident that vitamin D reduced the risk of asthma exacerbations, in these trials, we recognize that there is uncertainty about how these findings might be applied in clinical practice. Madam, you have gone one step beyond Cochrane database. If there is an associated viral infection, maybe it will help.
Maybe. That's if you prove to me that viral infections are getting reduced by vitamin D. That's another topic which was still controversial. There is still...
I'm going to come to
the verdict is not quite out there yet on that as well. But there are postulated hypotheses on this whole topic.
So yes. So does supplementing vitamin D help prevent pneumonia in children?
So I want to say just one more thing about asthma and vitamin D is that if you have rickets and your chest wall is very pliable, that could be, we used to see a lot of the, kids who would then have asthma, and that was one of the main reasons for having all the ricketic changes in the chest wall. So if you have the musculoskeletal, the effect of vitamin D on musculoskeletal system, the power of the muscular, the diaphragm, your intercostal muscles, there could be a connection between vitamin D and asthma. So again, it has to be adequate. No one will just, if you have got already adequate vitamin D levels, it's going to do nothing for you.
Nothing. Thank you. That is the message which is very, very important. Madam, regarding this adequacy and the compliance of the lung, of the respiratory system, we transiently face it in advanced pregnancy. Yeah, last evening, a patient delivering in the hospital. This morning was a different case. Delivering in our hospital, madam, she started coughing away. Not embolism, nothing. As soon as she delivered, everything was okay. And within an hour or so, everything pacified. Her lung compliance probably might have been compromised at that moment. We don't see this often, but yes, we can understand what you are telling as an obstetrician. But when we come to this Cochrane answer in relation to this, that overall the present study highlights that oral vitamin D has some beneficial effects in prevention of recurrent pneumonia in under 5 children, although not to a significant degree. And once again, the association which you have told comes out very clearly. Thank you for going even beyond the Cochrane database. Thank you. Vitamin D boosts immune deficiencies and reduces excessive inflammation. This is 2018 data. This is a different data. That it boosts immune deficiencies and reduces excessive inflammation, which may be the cause of this. So, madam, coming to you, still sticking on to you, Bella, in general, okay, infections in general, and here even Padmavati madam can step in. Both of you, how good is vitamin D in general reducing the incidence of infections like, say, pneumonia, diarrhea, TB, malaria? Both of you.
I think so. So the as I said, the theory behind the whole thing is that, vitamin D has some immune modulatory effects. It has effects on the T1 cells, the T2 cells, on CD4 cells, and all of them seem to be potentiated or inhibited in the right direction. So if that is finally, in vitro studies definitely show that, but we are not so sure about the in vivo effects of vitamin D on these various, what should I say, the phagocytic cycle, the IL-1, IL-2, IL-10, all these.
Macrophage activity.
The macrophagic activity. There is definitely in animal studies and in vitro studies, they've proved it in many studies, but we haven't quite seen the benefit in a sort of significant manner in vivo in supplementing children with this. So we are hopeful that at some point we will be able to get better studies and be able to be more confirmatory about this whole thing.
There is no doubt about it, because that is science.
But for the moment, we don't have any concrete evidence to say that it helps in any of these conditions. Once we know that it helps any kind of immune modulation, it will help with everything. It will help even with our autoimmune diseases.
Padmavati madam, would you like to tell us something on this?
Yes, there is a talk on infection and vitamin D by Cochrane database, but it very clearly says why the controversy. It asks the question, why the controversy? The controversy is because vitamin D receptors are present in a host number of cells, a large number of cells across the body, and one of them is immune cells. And in spite of being present in the immune cells, to be very frank, macrophages have receptors for ACTH and cortisol. What does it do? We don't know. So there are such receptors, multiple receptors present on various cells in our body. We have not elucidated their function. We do not know what they do. But as of today, vitamin D is not supposed to have anything to do with infections, preventing infections, making infections better or anything. Having said that, any deficiency state, whether it is vitamin D, protein, or general deficiency state, is going to impair your immunity in general. There are multiple factors there. And hence, vitamin D level should be sufficient. There is no doubt about that.
Thank you. Brilliant. Still, probably at the last part of pediatrics, at some conference, there was a session on breastfeeding. One of the advantages of breastfeeding stated was that the vitamin D supplementation to breastfed infants makes their bones stronger. This was the poster outside the hall. How scientific is the claim? Madam?
I think if you're saying that, vitamin D is not present in breast milk and we need to supplement vitamin D, and vitamin D is definitely proven beyond any doubt that it is required for bone metabolism and for making our bones, for calcium deposition in the bone. So it will make our bones stronger. So I think the statement is right. I don't think there's anything wrong.
Thank you. I love this picture. I'm going to put it outside my gym. Okay. We'll come to that. We are coming to the questions of for our Padmavati madam, endocrinologist. In a quest to, and general physicians, say like the Bansal madam was first an obstetrician and then diversified into area of infertility. In the same way, you are physicians in a quest to find a treatment or at least attenuate the devastation of the medical weapon of mass destruction. Whether it was political or not, I don't know, but it was surely a medical weapon of mass destruction. What all we have tried? It was a quest to find a treatment. Antiviral drugs, anti-inflammatory drugs, dexamethasone. Even I was given dexamethasone. Immune-based therapy, including convalescent plasma, mesenchymal cell, amlodipine, lostran. You all know this. I would like to ask Padmavati madam now, where does vitamin D supplementation stand in this as regards COVID is concerned?
In COVID, in 21, there are several studies, almost totally bar ke milega. But in all these studies, there was no qualitative evidence or definite evidence to say that vitamin D deficiency is going to do anything to the betterment of the treatment of COVID or prevention of COVID or even afterwards. Only
very uncertain. Yeah. Insufficient evidence.
Yes, that is the Cochrane database which shows that.
Oh, yes, ma'am. Thank you. Thank you so much. Madam, one condition which I would like to ask, because some of the pharma representatives are talking about this even in our clinics. And this is regarding cystic fibrosis. Yes. For me, when I was undergraduate, I learned cystic fibrosis. For me, or probably even for Ramesh sir, it was more a respiratory condition. But no, we know that it has got now, so many other things have found out. It's a genetic disorder, we know. Multi-organ effects. What do you think regarding supplementation of vitamin D and its effects in cystic fibrosis?
A very large number of studies showing that it may help, and the equally large number of studies showing that it may not help.
So please guide us.
And generally there is one point here, and the most important point is that generally cystic fibrosis, when they have been investigated, they have found that they are almost always vitamin D insufficient. So generally, this population has a vitamin D deficiency much more than the rest of the normal population. And that is why vitamin D supplementation in cystic fibrosis has been started. And hence, it helps in improving your vitamin D deficiency, but it doesn't have anything much to do on cystic fibrosis management as such.
Thank you, madam. This is what is repeatedly coming from the teachers, that there can be associated vitamin D deficiency. There things can go haywire. So please correct the deficiency part of it. Others evidence will follow. Madam, one more which we face when coming events cast their shadows. A patient delivered day before yesterday. She is a sickle cell trait, in my hospital. One problem which we medical practitioners, including obstetricians beside, so Aditi might also be facing it, that is sickle cell anemia. Sometimes back, vitamin D made an entry in its management of this condition. What is the current status of this use? Is there an association with the deficiency, or does it really help in sickle cell?
See how this sickle cell disease started talking about vitamin D deficiency. There's a background to it. They have lots of body aches and pains.
Yes.
And we know that in vitamin D deficient osteomalacia or rickets, if you have seen vitamin D deficient osteomalacia like me during my residency stays, they used to come bedridden. You touch anywhere and they are extremely tender. The skin used to look different. And the minute you treat them for a week, they would start getting up and walking around. There is a proximal muscle weakness or severe muscle weakness. There is also an extremely severe pain, including bone tenderness in them, which all disappears, and it's a classical osteomalacia which can come in. Similar feature is found in sickle cell disease, that generalized body pain, muscle pain, and things like that, and that's how they thought of vitamin D. However, these pains are not related to the vitamin D deficiency, but they are related to something else that is happening in sickling of the cells, giving rise to thrombosis and other features which are present. And again, in sickle cell disease, there's no evidence to say that vitamin D is going to do anything to the pain and other things, provided they also have associated vitamin D deficiency when things become worse, because the muscle pain also comes in. See, sickling, they are fairly sick babies, and sometimes they do not take adequate nutrition and other things, and hence they may have a role in replacing whatever is deficient completely. Definitely, there is no, like all the other articles, it ends saying that some more studies are required to prove whether it is of use or not.
It's okay. That shows the quest of science. No,
but that also shows that we don't know now anything.
No problem. So we don't change our policy as of now? Whatever
no, we don't change our policy. We treat vitamin D deficiency.
Until further evidence becomes available, clinicians should consider the relevant existing guidelines for vitamin D supplementation and dietary reference intakes for calcium and vitamin D in managing cases of sickle cell, as is mentioned here in this database. Madam, one more jadoo, and where lots of blessings we get, and that is chronic pain. One of the most underestimated healthcare problem in the world today is chronic pain. Has vitamin D any role to play?
If there is vitamin D deficiency, there is a very small portion of patients, and I've seen them in my practice. They come with generalized aches and pains, and I'm not feeling well. They are hardly moving out of the house, especially they are 60 or 70 years old. And when I put them on vitamin D, they improve. This was at a time when vitamin D levels were not even available. Put them on vitamin D and calcium, and they improve. A lady who was refusing to come and see me, the doctor would come and say, you write something. I said, I have to see the lady, make sure that it is nothing else, no other disease I'm missing. So they brought her. So I started her on vitamin D and calcium. And after 1 month, she comes to see me, and then she says, you are the first person suggested vitamin D, and I am now completely all right. So chronic pain can be a symptom of vitamin D deficiency, in which case that is the treatment. Nothing
no
else.
wonder, madam, you were a teacher for such a long time in medical college. And no wonder you are in the ethics committee, because you are not afraid to take a stand that yes, it will not help or it may help. Very clearly.
No, there is one more thing. Whenever there is vitamin D deficiency, when you have a vitamin D deficiency for a long time, you must always replace calcium along with it.
Yes.
Why? Because when you have vitamin D deficiency, calcium is not absorbed properly. And you know that vegetarian diet calcium is very poor. All the vegetables which contain calcium are not absorbed because phytates and carbonates which are along with them. And hence, whenever you see a vitamin D deficiency, you have to also give calcium along with that. Then only the improvement comes. Because what happens when there is vitamin D deficiency, calcium in the blood starts falling. And then the parathyroid gets activated. And whatever vitamin D is are converted into 125. Both of them take away calcium from the bone. And hence, a patient who is vitamin D deficient for some time.
This is why I love teachers. I mean,
so you have to give vitamin D plus calcium in deficiency. There's no doubt about it.
You bring in new insights, and that is what which we people are observing in practice, but you bring insights. And when you hinted on the vegetarianism, it is a big thing in our area. You will be interested in knowing this, that Gujarat and the parts of the country adjoining Gujarat, that is in Rajasthan, Maharashtra, Madhya Pradesh, this entire belt has been found to be the largest vegetarian belt in the world. And therefore, we have to be aware of this. And whatever be the reason, that is not it. Though actually, India is a non-vegetarian majority. In India, it is a non-vegetarian, but we don't go into those details.
You know, Pankaj, it would be very difficult to say that. I have a very large community from Mira Road who are Muslims who come to me. And I give them vitamin D because they are usually burqa clad, you know, ladies.
Yes,
most of them.
yeah.
And when I ask them, how often do you eat non-veg? I am very surprised to hear that twice a week or thrice a week, and some of them say we hardly eat non-veg.
Yeah. So yes.
They are staying in this country in this state for so long, they converted themselves into
this belt. Yes, thank you, madam.
Very surprising for me.
We now bring in our Ramesh bhai, and sir, we require your help now, and we will finish the discussion. When I was born, somewhere around this was the life expectancy of India. I'm talking of India, Ramesh bhai. Now, currently, it has gone beyond 70. We don't let people die. And increasing life expectancy in emerging economies brings in orthopedic problems, besides others. Quite a big chunk. Care of post-menopausal, and some people use this word post-andropausal, controversial, men or older men, is a big challenge for an emerging economy like ours. Panchal sir, does vitamin D have any role in preventing fractures of old age?
So it's a major issue world over, and now we are in Indian also going to face the same thing. The geriatric population is progressively increasing, which is going to lead us to the problems of musculoskeletal system as a whole, not only of bone, but it will include musculoskeletal system. Say once patient is having deficiency of overall deficiency, nutritional deficiency, which may include vitamin D also, will lead to osteoporosis and osteomalacia both together, and will have, as madam has rightly said, muscle health also requires vitamin D. So ultimately, if it is not taken care of, will have a frequent imbalance as well as fall, and ultimately you end up with fracture. More the fracture in older patients will have more problems related to fracture as well as surgery, as well as post-surgery complications and mortality. Ultimately, all these things we are going to face.
Sir, on the basis of what Bela madam, Padmavati madam has said, and now you are reinforcing it, should we routinely prescribe vitamin D irrespective of the deficiency in our older subjects?
Most of the time, yes, I would say.
Okay. Vitamin D alone will may not...
No. Alone will not be sufficient enough. because calcium supplementation is equally essential in both postmenopausal as well as older aged, even men and women both.
Okay, coming to steroids.
Yeah.
I had to be given steroids when my oxidation never fell below 98, 97. I was admitted for some totally different reason. 5 days I was in the hospital with my wife. We had a paid, sort of a semi-paid holiday. But then my fever went only after I was put on steroids. Short term, not very long term. But Corona has brought in corticosteroids in sharp focus as to both their good effects and bad effects. Now, one that was discussed was a lot of avascular necrosis of femoral head. Besides, other fractures are also discussed. But sir, I am not confining only to corticosteroids for treatment of corona. In general, there are multiple reasons why people can be on this. Can vitamin D help in prevention of steroid-induced fractures?
Probably directly may not. But along with, like say, avascular necrosis, when we have talked about, it is one which, and especially post-COVID, we are seeing almost, one phase was there, almost 4 or 5 patients in a week. Now at least 1 patient in a week. That much of AVN has, avascular necrosis of femoral head, has come up following second and even after third wave also. The cause of avascular necrosis is not yet clear. Probably people who have not got steroid as a part of treatment also developed AVN. And it is because of like what used to happen, like something like thrombosis in the lung vessels.
Yes, sir.
A similar thing has happened. Even it is a vascular insult or vascular thrombosis which has led to this. And those patients who are having more of like something, physiological study says that 30% of patients have one vessel which is supplying femoral head.
Yes,
and those patients are going to have direct effect of avascular necrosis. So that is one part where directly vitamin D may not be that effective, but some group have said that steroid also taking part in AVN as well as the other issues, where at least in post-COVID, normally people, when we used to see only steroid-induced AVN, it was something like 800 milligram of total dose. Now it has reduced to 400 or even 500 milligram, and maybe even earlier than what we used to see after 8 months or 9 months. Now we are seeing at 4 or 5 months. So this is what has changed in corona.
Okay, sir, a little older issue, 1998. Meta-analysis demonstrated a clinically and a statistically significant prevention of bone loss at the lumbar spine and forearm with vitamin D and calcium in corticosteroid treated patients.
Yes.
You agree with it?
Yes, yes.
Okay, thank you. Many orthopedicians start oral multi-nutrient supplements before or soon after hip treating surgery. Interestingly, my best friends have been orthopedicians. I don't know why. I'm very comfortable with them, and therefore, as soon as the organization rang me up and said we want an orthopedician, I just picked up your phone and talked with you. And I asked one of them, how much does this help? Oral micronutrient supplementation along with vitamin D before or soon after hip fracture treating surgery. The answer was, it does prevent complication within the first 12 months after hip fracture. After that, it is all same. Do you agree, sir?
Yes, primarily hip fractures in geriatric. All patients are to some extent under nutritionally placed. So supplementation prior to surgery and after surgery will definitely help in recovering overall patient, which may prevent some of the complications, not the mortality. Mortality doesn't change. Truly speaking, say following fracture, hip fractures, mortality is not changed because of giving vitamin D or nutritional, but it can definitely prevent some complications which are going to occur in due course of time.
Thank you, sir. We require indulgence from any one of you on the panel now. We are coming to the last in the general part of it. Does vitamin D supplementation, sir, Panchal sir, you have put your foot in it, so please hold on. Does vitamin D supplementation have any effect in reducing cancers in general? That we will ask Padmavati madam. And prevent mortality in adults. Mortality, you have said no. Padmavati madam, does it prevent cancers?
No.
No.
Doesn't do anything to cancers. Cardiovascular disease, there is some query which is going on. in relation to mortality, there is a U-shaped curve. They found that a lower vitamin D increases mortality, but a very high vitamin D also increases mortality. So they are not very clear. There is the final data is not out, but definitely if you want to prevent cancer, reducing obesity is far better means, because that has proved that it reduces cancers. But vitamin D has not shown that.
Thank you so much. There is currently no firm evidence that vitamin, as you say, but madam, this group was only elderly community dwelling women. We require more, as you said, for men, low and other groups, including all others. This was 2014.
The problem in this study was they took everybody and gave vitamin D. They did not find out whether the lower vitamin D fellow did better and the higher vitamin D and normal vitamin D remained the same. Then it would have made a difference.
Madam, regarding mortality, your comments, Bela madam, your comments, Ramesh bhai has already said. What do you feel?
Yeah, no, so I don't know about mortality. I mean, I don't think, as I keep reiterating, if you have severe vitamin D deficiency, you need to treat it. Okay. You supplement it with normal 400 units or 600 or 800, whatever you decide is your daily maintenance dose, that you should give so that you don't become deficient.
Okay.
But other than that, vitamin D on its standalone will not do anything for you to decrease your mortality. You should not be deficient. Like any other food product, any micronutrient, you need to have adequate levels in your body to have a healthy and enjoyable life.
So usko भगवान मत बनाओ. Vitamin D
भगवान मत बनाओ. हर चीज का वो एक panacea नहीं है कि जो होता है सबको vitamin D.
Yes.
Dr. Pankaj, I just want to get some suggestions or clear my doubts from Dr. Padmavati or you or anybody. This is regarding the association of vitamin D with so many genes, especially the VDR gene and the colorectal cancer, etc. Any light on that?
There is no evidence till now.
No evidence.
Unfortunately, that is the problem. And there are, I have something like 200, 300 references because somebody asked me to take a lecture on that. So I collected whoever said yes and whoever said no. And finally, the Cochrane database said that there are a lot of problems in the studies which they have done also. They're not uniform and they are not comparable. There's a last sentence which is very important. Vitamin D3 combined calcium increased nephrolithiasis can occur, but both alpha calcidiol and calcitriol increased hypercalcemia. So very often when some people prescribe combination of vitamin D3 with calcitriol, do not prescribe to elderly because they do get hypercalcemia and they do come with symptoms of hypercalcemia. So that we should be aware.
Yes, that is also the aim of this panel, to sensitize you to the dangers of it.
Yes.
To the dangers. Thank you, Padmavati madam. So we come to the eternal question with which we started. First, very quickly, what is a vitamin? As Medline Plus tells, vitamins are substances that our bodies need to develop and function normally. And hormones are your body's chemical messengers. They travel in your bloodstream to tissues and organs. They work slowly over time and affect many different processes, including growth and development. Therefore, now my question, is vitamin D a hormone or a vitamin? The last part, and then I'll finish it up.
It's both.
It's both.
It's both because vitamin D is not made in the body. It needs sunlight to make something there.
Okay.
So there is some pre-chemical substance, but it needs something to make it there. Do you know something? One of the heading which I read in Endocrine Review is muscle and endocrine organ. Such a lot of research saying that muscle.
I have written a blog on this, and the title of the blog is our platelet, because we as preeclampsia, people who work in preeclampsia, are very sensitive to platelets. So muscles and platelets. Is there a link? What is the link between muscles and platelets?
There is quite a lot of link between
yes, madam. They are both
muscle and every tissue. That's a different topic. It is just to show you that our knowledge is still gagar mein sagar ka pani. There is a lot of knowledge which we are lacking, and there are a lot of tissues which have much more functions than we can ever imagine. Secret, like myokines, we didn't know so much of muscles which can do to glucose metabolism, to vasculature. I mean, surprising. So hence vitamin D is also in that term.
Therefore, I did not ask it at the first
vitamin
time.
as well as a hormone.
It is both. A hormone
it is
as a
formed
vitamin.
in the skin and acts somewhere else.
Panchal sir, you agree to this?
Yeah, it is.
Yeah, madam, you agree to this?
I agree. Yes.
Okay.
Yes, definitely.
Madam, you agree to this?
Yes, sir.
Yes. And Aditi, do you agree to this?
Yes, sir.
Okay, thank you. We went into this panel discussion. When I sat down, I have got only 10 days. I have never got such a short notice for a panel, and I require lots of work. I require 1 month, but when it comes from Duru, it becomes a command for me. That is a relationship we have for 30 years at academic and in Foxy and all. I went very mystified with the topic. I was like this. But thank you, teachers. You have done a wonderful job. You have lifted us, pulled us out, all of you brilliantly, from the pit of ignorance and irrationality to the light of knowledge. Now I can say that we as practitioners who are wedded to the service of humanity will be very happy today with wonderful messages. And with this last message,
please convey our thanks to Durusha and the organizers of PCOS this talks.
Thank you very much for having us on this panel.
Thank you all very much. Thank you so much.
Thank you.
Thank you. Pankaj sir, we have a few questions from the audience. I have just sent.
Why is vitamin D regarded as a hormone? Yes, how is vitamin D produced in the human body is a very theoretical. Some of that was covered by Bela madam and Padmavati madam. What are the endocrine conditions associated with vitamin D? Padmavati madam, any other than these conditions which we have discussed?
No, we don't have any endocrine disease as such, but as Dr. Bela said, there are other genetic disorders where it can be vitamin D resistant rickets. That's a different cup of tea altogether. So
and how is vitamin D deficiency related to hormonal imbalance? Any relation with any hormones?
No, not much of relation
and,
with that. You have with kidney. Remember kidney. Kidney is related very much to vitamin D.
Yes. And how frequently we should test vitamin D?
You know, USPSTF, that is an organization which looks at it, says that if there are no symptoms, there is no need to investigate. Now, if you look at the test, they said it is very simple test, but it costs more than 1,000 rupees. So if you have a burqa-clad lady, there is no reason why you should do a test. You can start her on vitamin D and calcium. If you and me sitting in the office and never going to sunlight during 10:30 to 3 o'clock, yes, we are not getting sufficient vitamin D because food doesn't supply any vitamin D at all. There is no addition of additives in food like vitamin D, and hence you can start vitamin D. And if you give once a weekly 60,000 units for 6 weeks and then once a monthly, you will not have deficiency. But depending, all postmenopausal women should be treated with vitamin D and calcium. You know, Dr. Ramesh Panchal showed the slide that what it does is it makes sure that the bone which you have is retained there and it doesn't go away.
Yes.
But at the same time, to prevent osteoporosis, there is something else which is very, very important, and that is exercise. You cannot just take vitamin D and calcium and say that my bone is going to become all right. So if you want bone mineral density to improve, you have to do some exercise. Muscles have to move. When the muscles move, that's a very good stimulus for bone formation as well as for improved health. And hence, please remember when you are treating osteoporosis, tell them to also do some exercise. Can be walking, can be swimming, can be this thing, anything.
Dancing. That is what I do.
Exercise.
Zumba dancing.
Oh yes, but not at your age. Not in the postmenopausal age. They will ensure something. Not in the postmenopausal age.
Yoga.
Weight-bearing exercises are required.
Yes, resistance exercises are required, and that would be very good.
And we have a few acknowledgements. Obviously, all our delegates participating in today's webinar. Our moderator, Dr. Pankaj, thank you for such an excellent session. And you took us through a myriad of various situations from childhood to adulthood and finally old age also. So thank you very much, sir, for the crisp and precise presentation. I'd like to thank all our experts, Dr. Kanti Bansal Madam, Dr. Padmavati Menon Madam, Dr. Ramesh Panchal Sir, and Dr. Bela Dr. Madam for taking out their time and giving us such valuable inputs and making our understanding so well in this subject. The Omnicaris team for the platform, Torrent Pharma for supporting today's program, and obviously the PCOS Society team for organizing such excellent webinars time and again. Thank you very much.